Let's look at the internal anatomy of the kidney. The kidney consists of outer renal cortex. So this side here is called the outer renal cortex, and inner renal medulla. So from here downward here is the renal medulla. The main unit of the medulla is the renal pyramid. So this is the renal pyramid being occupied in the renal medulla. Okay, so there are about 8 to 18 renal medulla. So it's 8 to 18 renal medulla, and this renal 8 to 18 renal pyramid in each kidney, it appears triangular. So this renal pyramid here appears to be triangular, having a base and apex. So this base here is projecting towards the cortex here. We call this junction between the cortex and the medulla is called the corticomedullary junction. At this area, that's where we can find the base of the pyramid. Then we also have the apex projecting towards the hilum here. So this area is called the apex of the pyramid. Okay, so at this apex of the pyramid, it's called the renal papillae, which contains the papillary duct or the duct of Benelin. Okay, so that is where the collecting duct is being found, and it is being drained into the minor calyx. Okay, so one or two minor calyxes here. So this area is called the minor calyx, So one or two or three minor calyxes join together to form what we call the major calyx. So the one or two major calyxes continue to form what we call the renal pelvis. So this renal pelvis now continue to form what we called continues as the ureter at the uretero-pelvic junction, the junction between the pelvis here and the ureter. Okay, so at this renal pyramid, each of this renal pyramid are being separated by an extension of this renal cortex called the renal colon. This is the pyramid here. This is a pyramid here. So this extension, this demarcation from each of this pyramid is called the renal colon. And we also have in the kidney, we have a kind of cavity here that contains the renal calyces, that contains the blood vessels, the nerves, and this area is called the renal cynosis, that contains fat like perinephric fat, and it is the most common site for renal cysts that we can see in the kidney. And okay, so when we look at the medial border or the medial border of the kidney, we see the projections in and out of the kidney. So this is the renal artery located anterior to this is the renal vein located anterior to the renal arteries. Okay, and these renal arteries here are located anterior to the renal pelvis or the renal pelvis. So the renal pelvis appears to be more posterior, then the renal artery appears to be in the middle, and the renal vein appears to be most superior or most anterior.